Dr. Schaefer here, physical therapist, here to show you an exercise I call a single leg donkey kick. So essentially what I'm going to do is find a nice TheraBand with a big loop around it. I'm going to kind of step into it. It's going to go all the way up to as far as you can in your hip joint, near your groin. Take a few steps away, get some tension in the band or whatever resistance you're using. I've just got a cane here for most patients, just for balance to stay safe. So what I'm doing is I'm picking up my right leg, and then I'm just slightly kicking back my leg into an extension motion. So you'll feel that in your hamstrings, in your glutes, a little bit in your back. That's okay. So I'm here, I'm balanced. I just kick back a little bit. What you'll find most often is patients will just blow through all that intensity or motion, and they'll just go like this. Or if they're lacking any sort of a hip extension motion, they'll actually just extend from their lumbar spine. So they'll try to extend the hip, and they'll try to get there any way they can. So they'll kind of, I'll exaggerate a little bit, they'll kind of just arch their back. Arch their back. But the best way to do it is to be nice and upright. You just kick back just a little bit and back down. The hip joint itself only has about 15 to 20 degrees of extension, so it's really not a whole lot of motion. But if you don't have that motion, you'll compensate at your lumbar spine. So if you notice that yourself or patients are not doing that correctly and they're arching their low back, maybe work on a little bit of hip flexor mobilization, a little bit of hip extension, using a band for assisting, or just doing some self-stretching. Thanks for watching.